Hi, good afternoon, everyone. My name's Candy. Tonight we are going to be discussing the medication Gabapentin. For me to do this, I'm going to have to tell you what it is, what the medication treats, how it works in the brain receptors, and I am also going to tell you about the benefits and the dangers. I'm going to tell you about the side effects, and lastly, I'm going to tell you about the medication's abuse. Now that we have a small outline of tonight's talk, let's begin. So the name and the category. So of course we're going to be talking about gabapentin. The category is going to be a anticonvulsant, Schedule 5, controlled substance. So what does this medication treat? Gabapentin is an anticonvulsant medication that treats epilepsy, particular nerve pain, seizures, and other conditions. This is by the Salem Press Encyclopedia of Health. Gabapentin is used off-label without specific FDA approval to treat severe chronic nerve pain due to nerve damage, diabetic neuropathy, multiple sclerosis, cancer, and it is also used for acute treatment for bipolar mood disorder, migraines, headaches. It sometimes can be prescribed for menopause, hot flashes. This is by the Gale Encyclopedia of Cancer. You can also see behind me, I've got little slides on my little board. So the first one is, of course, if you can see, the drug name and category. Kind of tells you a little bit about it. And then we'll go down to B, what does this medication treat? As we go through each category, I'll kind of show you my little board. So how does this drug work? What functions in the brain does it impact? The medication affects the neurotransmitter, specifically the gamma-antibutyric acid, which helps reduce nerve-related pain and alleviate symptoms associated with certain medical conditions. Gabapentin is considered a half-life, which is the time it can absorb in the body system. So the bloodstream, it takes 5 to 7 hours to absorb. Time peak drug concentration is 2 to 4 hours, and absorption is satable in a dose, with a reduced absorption seen at a higher dose. There have been doses tested in the RCT range from 600 to 1800. Only 3,600 have been used in clinical practices. This came from the Epilepsy A to Z Concise Encyclopedia. The medication can stay in your bloodstream at all different rates of testing done. In the laboratory, if the laboratory wants to do a test by blood, it lasts 5 to 7 hours. If they test it by your hair, 90 days. Saliva, it can last up to 24 hours. And lastly, your urine, which most people have it done by, is 3 days. What are the benefits of the drug? And what are the dangers? So let's first talk about the benefits. So the benefits is it helps manage pain for restless leg syndrome, anxiety, seizures, and epilepsy. It's safe for children, dogs, and cats, and helps with other health conditions. The dangers include suicidal thoughts, addiction, and high rates of misuse. If you look on my little board that I did, we'll show you that. So, of course, we have C, where we talked about how the drug works and what functions in the brain it impacts. And then also we're going to go down here and we're going to talk about, can you see it? Okay, well, put it right here first. We're going to talk about, can't see it, I apologize, right here. The benefits. See my little pictures. And then, of course, we have the dangers right here. All right. Next, we're going to talk about what are the common side effects. So the common side effects, a little blurry, sorry about that, guys, is dizziness, fatigue, sleepiness, fluid retention, headaches, and dry mouth. Long-term effects are, or can be, memory loss, altered mental health, respiratory depression, which is hyperventilation when ventilation is inadequate, and then we have a couple serious side effects that we can talk about. And that's going to be swelling, rash, seizures, and difficulty breathing. So let's go ahead and talk about the abuse. So, gabapentin misuse is an ongoing concern due to its addictive nature, even though it is a prescription medication. Gabapentin is misused alone or in combination with other substances such as bute, methadone, opiates, and benzodiazepines, as well as alcohol. This combination of medication can be recreation, self-medication, or self-harm. Several cases studied state that the euphoria experienced after gabapentin misuse resembled recipient of, but not as strong as opiate use. This came from the Gabapentin Misuse, Abuse, and Diversions. So individuals also stated that their experience feeling sociable, like a marijuana high, as well as a cocaine-like high by using gabapentin. This was also studied by the Gabapentin Misuse, Abuse, Diversion. Other individuals have stated snorting gabapentin powder from capsules was experiencing a high like snorting cocaine. Sensation of gabapentin from gabapentin was sedation, relaxation, calmness. Gabapentin misuse, abuse, and diversion as well. So now that I have given you some information on the medication gabapentin, this will hopefully help you to know some facts of the gabapentin. Please remember always to talk to your physician before starting or taking any medications. If you or a loved one is in danger, please call 911. If you or someone you know is in crisis, call or text 988. And if you need help with addiction, please call 1-800-662-4357. I hope this little presentation helped you have some information on gabapentin. I do believe I forgot to show you a couple of my slides on my board. So here's a couple of them. I have the side effects, and then as well as the abuse of this drug. You can see people getting high from the capsules. They're being sociable and snorting it and having a great time. I hope this video helped you. You have a great night. Thank you.